I work with women all the time who talk about their periods, and they talk about things that they think are so normal. And I always like to remind them that they're common, but they're not normal. They talk about their period almost like it's some sort of club. It's so painful. It hurts so much. They feel crazy. They feel like they can't move, they can't think, they can't feel the way that they want to feel, and they think it's normal. It's not normal, it's common. Those are two different things. I'm Valeria. I'm a women's health nurse practitioner. I work here at Root Cause Medical Clinic. I'm a conventionally trained, board-certified women's health nurse practitioner who spent a long time in conventional medicine before I came over to functional medicine, where I get to find the root cause of women's health issues. I get to work with women from all different backgrounds to figure out the why. Why do women think their hormones are such a mess? Because they're not supposed to be messy. It's complex, but it's not that complicated. And what we do is we dive in with testing. We dive in by looking at environment. We even get to look at food, because there's so much more to the terrain of women's health. It's not just about hormones. It really is about what the body's trying to tell you. When I work with women, one of the things that I see most often is really heavy, painful periods. They might be irregular, meaning they happen not every month on a regular cycle. They might be regular every 28 to 32, 34 days, but they're still painful. They're still heavy periods, and they've had them for a long, long time. What I find most often is that this is not because things are normal. It's because your body's trying to communicate in a different way. And this often presents with gut infections, nutrient deficiencies, inflammation, autoimmunity, mold, environmental issues, other toxicities, hormone imbalances, chemical exposures. There are so many different things that can contribute to heavy periods. And what we do is slowly unravel why these things take place. And the period is the monthly report card, which means it shows your body what's going on physically that month, the month prior, the month before that. When women work with us to find the root cause of why their periods are heavy or why their periods are painful, sometimes it's a surprise that it's not about the period at all. It's about your gut health. It's about your nutrient deficiencies. It's about your toxic exposures. It's about so many things that might be everything from what's in your house to what you're eating to what you've been exposed to. And this can be solved. And I really want women to know that, is that these are things that, yes, they're common, but they're not normal. And so if we really dive in at the foundation, meaning what goes into your body every day, are you pooping? Do you have things that are creating issues inside the gut? Do those issues become immune system issues? Do those then become inflammatory issues? Is that what hormones are responding to? Because most often the answer is yes. And the reason for that is digestion matters so much for hormone health, because oftentimes women don't understand the cascade. Hormones are messengers, which means they're responding to something. The question isn't what are your hormones doing, it's what's the something. And inflammation caused by the immune system can wreak havoc on your hormones. If a woman's hormones are disbalanced, we have to look at a source that oftentimes is really unexpected. So what we're looking for is much, much deeper to figure out the basics. Is the foundation okay? Usually when you fix the foundation, suddenly the periods aren't so painful anymore. They're not heavy anymore, and you kind of get to just forget all about them. We use personalized lab testing to really get at the root of why symptoms are happening. One of the tests that we use is called the Dutch test. It's a test I personally love and use often, and it looks not just at hormones, but at hormone metabolism. This test looks at everything from melatonin levels to neurotransmitter metabolites. It looks at cortisol levels, which is so important when we think about hormones. Hormones are not just what we hear always as testosterone and estrogen and progesterone, if that. You're also looking at physically, what is your body doing at different points in the day? That's one of the reasons I love the test, is you get to dive in and say, you are changing hour to hour. Why not make it work? I'm Valeria here at Root Cause Medical Clinic. I'd love to get a chance to work with the women who really want to dive in to figure out the root causes of their health issues, their hormone issues, their gut issues, and live life on their terms.